share my screen. Share screen. Yeah, and then open the cases. Yeah, the cases is there. So, Dr. Isra,
Yes, I'm here.
sharing. Yeah. So I will open the 3 minutes. Okay.
Okay.
And then you have a read, and then we'll have a discussion what you can think about it, and then we'll go for the case. Yeah. Yeah, I will just double check if the recording is working because yeah, recording is working. That's good. And then yeah, Dr. Isra,
Yes.
just so so seeing the the information here, what do you think?
Okay, so because the girl is only 18 years old, the
Mhm,
dizziness and headache, I feel there are few reasons it could happen. Like, I'm
mhm,
not sure, like, maybe we can get more from the history, but headache could be either it can be migraine, it can be from the pill that she is taking, which is the desogestrel pill, the side effects from that. It can be migrainous type headache. It can also be tension type headache if she's doing some, leaving cert exams or something. Might be some kind of drug use that she's taking over the counter,
mhm,
which is causing these symptoms. Dizziness and headache can also be due to anemia. So trying to check her, what is her
mhm,
bleeding, any where she's bleeding from and things. And red flags of headache are important, but I'm not sure how much for her age because she's only 18. But still, we can
mhm,
check, for example, subarachnoid things and whether how is the onset of the headache, is it very severe, any nausea or vomiting with it, and limb or leg weakness, of course, and any family history of anything that we should know of. So that's come to my mind really. And then depending on what I find, then we can go to the management and what's her eyes.
Yeah, exactly. That's good. So for me, when I see the age by itself, so a
Hmm.
teen, it's a teenager, isn't it? So
Hmm.
my first thing will, my first red flag is will be sexual health, mental health. Okay,
Hmm.
these are the first two, and then yeah, for sure there will be some, genuine, physical health. But is
Hmm.
it genuine or it's hidden and it's presentation for different pathology? Okay, is it psychosomatic or not, or is truly genuine, serious problem
Hmm.
there? That's very important, to think, the first only, 3 minutes before entering to the station. And the other thing that I will notice, oh, they give me little information there. This means that
Hmm.
there is a lot of questioning I need to do. Okay.
Hmm.
The less information there, the more hard work you will do. Okay. Actually,
Hmm.
when you have a case that they give you only one paper of information, this means that you need to do a lot
Hmm.
of works. If you give you information that covering three papers, then they give you most of the information there, and the key of the key
Hmm.
of the differential and the key of the case most probably is in the written, in the written paper, in the
Hmm.
information that they give it to you. But if there is no written information, this means that you need to distract the information from the actor, either from the talk, either from the social cue. So that's very important. And then trying to use the other bets. Okay, she's in Ventolin, she's in Clinical, she's asthmatic. Okay, then you need to ask about her asthma. Is it controlled? Is it related to
Hmm.
the symptoms? Maybe, maybe not. Okay, but all of these that the things that should go through your mind, and then lastly, that can also giving you another hint that that might be, sexual health case. Oh, why they put the disogestrel there, yeah, why
Hmm.
they bought the contraception. Usually the people who is using EMS or system one, the usually when you are prescribing the contraception, you are prescribing the contraception for 6 or 12 months. So usually it will not be on the repeat medication, it will be in the acute medication. Okay, so why in the exam they will put it there? So there must be something, might you might use that in your in your management of the case. So all of this will go through my mind, okay? Why they give me these data and how can I use these data in the management of the current case? And then the last 10 seconds, okay, this is my thoughts. I put my thoughts in the white paper. I put my thoughts in the, whiteboard. Then I need to neutralize my thoughts, wait and see what is the plan of the patient. And then if it's going with my thoughts, well and good, I already prepared my plan. If it's different, then I'm open to change my plan in any way and maybe use some of the pre-existing plan that I make in the current plan of the patient, and just reach a common background between both of us and go through the management plan
Hmm.
according the wishes of the patient as well. Okay, so this is how you need to use the 3 minutes without being fixed. Okay, don't be fixed. Okay, because you don't know what the patient will will surprise you with.
Hmm.
Okay, so
Hmm.
are you happy for us to proceed?
Yes, yes.
Yeah, sure. I will open the 12 minutes. Yeah.
Hi there, hello. My name is Dr. Asim. I'm one of the doctors at the surgery. Can I confirm I'm talking to Jessica Brown?
Yeah, I am Jessica Brown, doctor. Thank you for calling.
Okay, okay. And can I confirm you're 18 years old, Jessica?
Yeah, yeah, I'm 18 years old. Yeah.
Okay. How can I help you today?
Well, to be honest, doctor, since I wake up, I feel dizzy and headache, and really
Hmm.
it was a weird night yesterday. And I'm not sure why I'm still having headache. I feel sleepy. I'm not in myself,
Hmm.
to be honest, doctor.
I'm sorry to hear how you have been feeling. I'm sure we could help you more. Can you tell me that did these symptoms start this morning or has this been going on for a while?
No, so well, yesterday it was. I was very happy. I was
Hmm.
very excited, and
Hmm.
then the night was very weird. I can't
Hmm.
even remember what happened in the night.
Hmm.
But then in the morning was more weird, to be honest. And then I started to have this headache and dizziness.
Hmm. Hmm. And how long has the headache been going on for since the morning now?
Well, it's not that bad. It has been going on for since I wake up. Okay,
Hmm.
but but still, and I took some paracetamol. I think it's controllable, but this
Mm,
dizziness is not making me, feeling comfortable.
mm,
And really, doctor, yesterday was a weird night. The night was weird for me.
mm,
I can't remember what happened yesterday.
mm, mm. Okay, so I see that you've mentioned a few times the night was weird for you.
Yeah,
Do you mind
yeah.
if you just elaborate this a little bit as to what happened last night? Do you have any thoughts about what could have brought this on?
Well, to be honest, yesterday I went to my first date, okay,
Mm,
with that guy that I met in the gym.
mm,
Okay, he's a very nice guy.
mm.
Well, we went to a very expensive restaurant. He was
Okay.
very gentleman. He paid.
Mm,
Yeah, the drink was nice,
mm.
And then, to be honest, after that, I can't remember what exactly happened, doctor.
Okay,
All
okay.
what I remember that when I wake in the morning, we was in his flat.
Mm,
That was a little bit weird for me,
mm,
I'm not that easy. Don't just misjudge me, please.
mm,
I never go to the guy house when
mm,
the first date, but
mm,
well, that's what happened. We went there, and then he said
mm.
it was a good night, but he didn't elaborate what.
What?
I'm not. I mean,
Sorry, I'm losing your voice. Yeah.
yeah, I'm saying I'm not sure what happened, and it's
Mm-hmm.
just I'm not, I'm not weirdo, but it's just I don't know why I have this dizziness.
Hmm. Okay, thank you so much for sharing your concerns with me, Jessica, and what happened last night. This might be related with your dizziness and headache, but
Okay.
let's explore this a bit more. You said that you found yourself in that guy's flat. Did you know his name or his credentials at all before you met
Yeah,
him
yeah,
last?
yeah, yeah,
Yeah.
yeah. But we didn't met last night. We met
Mm.
in the gym. We have been,
Okay.
we have been. I know him, he's my colleague in the gym. And
Okay.
then, yeah, and we are training with each other.
Okay.
We have been training now for maybe 3, 4 months,
Mm-hmm.
But
And
but the last couple of weeks, he started to approach me.
mm,
Yeah, I like him. I
okay.
feel that he's a good man, and then he invited me for that date, and we
Okay.
decided to go out. Yeah,
Okay, so it seems like what you were telling me, it was a mutual thing to meet up and you both had developed some feelings towards each other.
yeah, yeah.
Am I right to say that? Okay, fair enough.
Mhm.
And would you think that I know that I'm going to ask a few personal questions, so there might be sensitive information here, but might be related to your symptoms. So I'd appreciate if you could answer them. Like, did you feel that or do you have any idea from any vaginal discharge that you've been having since this morning or anything that you might have been intimate with him last night?
I'm not sure, to be honest, doctor, but the weird thing, I can't remember. I can't remember
Mm,
even me going to his
mm,
flat, his bed.
mm.
I can't remember. I'm not sure what happened. He
Okay,
said it
fair.
was a good night, and he didn't say what does that
Mhm.
mean.
Before that happened,
Well,
can I
yeah,
ask you that did you have any drinks, like any alcohol or any
yeah,
other
yeah,
thing?
yeah. He did pay for. Yeah, he did invite me for drinks. Yeah, well, he buy this, yeah, he buy very expensive red wine, to be honest, and I like
No.
red wine.
Do you
Uh,
think you drank more than what you would usually do?
no, doctor, what I remember that I drink only one glass.
Okay, fair enough, fair enough.
Yeah,
And just a
I'm
few more.
cautious. So I was cautious about not being drunk, especially in the
Mhm.
first date.
Mm. Just a few more questions that might be relevant, please. In terms of smoking, do you smoke at all?
No, no, doctor, I'm not smoking
Okay,
at all.
okay. And would you have any thoughts about whether you were or would have taken any drug at night time when you were in the pub? Because sometimes when you go outside, you can.
No,
Is it anything?
no, I never take drugs, doctor. No,
Hmm.
I'm not that kind of girls, doctor.
Hmm.
No, no drugs at all.
Okay. And have you opened up with this man that what happened last night, and has he tried to tell you what actually happened and how you found him yourself in his
Well,
bed?
yeah, to be honest, we didn't talk much because when I wake up, he was in hurry. He wanted to go to his work, and he took
Mhm,
his cell
mhm.
phone and went, and he told me, feel comfortable, do
Okay, fair
whatever
enough.
you want, and then you
Okay,
can go
okay.
whenever you want. Yeah.
Okay, just with your headache and dizziness, I'd like to check a few things. Did you vomit at all or feel sick?
No, no,
Okay, and did you have any blurring of vision?
no, no,
Did you notice any changes in terms of your speech, any slurring of your speech when you woke up, or you woke up quite confused or dazed?
no, no,
Okay, and did you have any chest pain or any heart racing at all?
no, doctor, no.
Okay, so other than the headache and dizziness, you feel fine, and you've never felt like this before, am I right?
Yes, yes.
Okay. Now, where are you now, and how do you feel in terms of your mood?
Mm, Yeah, my mood fine, but it just I'm surprised about what might happen, to be honest.
Hmm.
And also I tried to go and, change, and then I'm not sure, doctor. I'm not sure, to be honest. I feel,
Hmm.
yeah, I'm not sure. I don't remember that I took off my underwear, but my
Hmm.
underwear was upside down, was not in,
Okay.
and I won't,
Do you feel
I'm not,
pain down below or any discharge?
uh, Uh, well, there is some discomfort,
Hmm.
but no discharge, doctor.
Okay, okay, fair enough. And you are taking the contraceptive pill. I see that on your notes. Is it
It,
something that you continue to take daily?
I didn't take it yesterday,
You
doctor.
didn't take it yesterday.
No,
Okay, fair enough. That is fine. And did you take it this morning?
no, doctor. To be honest,
Oh,
until now I didn't take it. Just I
mm,
feel spaced a little bit. I'm not sure.
you feel a
No,
bit
I didn't
spaced.
take it.
Fair enough.
Yeah.
Like I see, I absolutely heard your concerns. Is there anything else you were concerned about today?
No, no. It's just I feel that I might need help. I'm not sure what happened,
Yeah,
doctor. I'm not
yeah,
sure.
yeah. No, I'm hearing you. I'm getting where, we perhaps we are both getting on the same page. Was there anything particular you were hoping from? Because I can see you sound quite distressed.
Uh, Perhaps, doctor, if you can, if I can come and you might maybe examine me or
Mhm.
something. I just don't feel comfortable, doctor. I feel there is something wrong.
Okay, fair enough. Okay, Jessica, based on the information that you've told me and you feeling quite dizzy and having a bit of headache, that started only suddenly after last night's venture, I do feel that this could be related to what might have happened last night. Now, it's very difficult to say right now what could be the cause. There could be a few things that are running through my mind. Tell me if you agree with my thoughts. One thing could be that maybe, as you said, your underwear wasn't there, it was turned upside down. You found yourself in his flat. Could it be a possibility that he could have sexually abused you without you knowing? Has that run through your mind?
To be honest, doctor, I'm not sure,
Hmm,
but it might be, and I don't know what to do.
fair enough. Fair enough.
Especially he left. I
Yeah,
tried to call him, but no one is answering the phone.
no one is answering the phone.
Yeah. Mm.
So if like there are a few ways we can go about this. Like first of all, I'm happy for you to be seen. However, I won't be able to do any intimate examination on you if we are suspecting that this could be a case of sexual abuse. But
Okay.
I can bring you in. I'm more than happy to bring you in just to measure your blood pressure as well because you feel dizzy and you have a headache, and just to take note of your pulse and have a feel of your heart just to see nothing is going wrong. But at the same time, I need you to think about that if this is something which has involved you sexually, and that's what we are thinking of, we might have, you have the option to involve the sexual abuse service as well, which is the sexual and rape services, and we can get them involved and they can provide you help if you are not able to get hold of that person and you feel lonely. What what are your thoughts on that?
Yeah, I think, yeah, if I come and you feel that
Mm,
might something happen, yeah, but
mm,
what they can offer us? I mean, what they
mm.
would help me with?
Yeah, so obviously, first of all, they would try to determine if something like that happened by doing, analysis down below or checking if there is any parts of semen there at all. And the other thing would be that, obviously they also provide support in terms of mental health or well-being if that's what they have found, because that might be something you would benefit from because you seem quite disturbed.
Okay, yeah,
On
I
top
think
of that, I would also like to advise you that because you didn't take your pill and if you did have a sexual encounter, it's best to cover yourself with some emergency contraception. And I can talk about this when you come into the clinic. What are your thoughts about that?
yeah, I think I will come, doctor. Yeah, I think
Hmm.
we might
Hmm.
need to take this further, doctor. Yeah.
Yeah, I think we might need to take everything into account and not ignore anything because this can be serious, especially if you haven't had your and contraceptive pill.
Yeah. Yeah, continue, no, continue. No, you're doing great job. Continue. Yeah, that's fine. I mean, for me, yeah, I'm happy with your, your way, but continue what you want to say.
Okay, so that's what run through my mind at the moment. Now we're not sure about any of this. What I have talked through, yeah, this is just we are raising this as a suspicion. So let me bring you in. We can have a more detailed talk about this. If you want, we can involve the sexual and the rape service as well. And there are lots of support there that is available. And you could try calling him back again if you wish to. These are the few options we can discuss when you come in.
Sure, sure, doctor. But just what contraception you will be able to offer me, doctor? What
Mhm.
emergency contraception?
Okay, so it we can have a more detailed talk about about it, and it's mainly around because with the POP it's difficult. Some people don't get a period on it, so it's very difficult to judge on what part of the cycle you might be in. But
Mhm.
there are few forms of contraception which can be in the form of a pill or even a coil if you're not looking to get pregnant anytime early later on as well. That
Okay,
there are different options.
good, good. So let's have a discussion. Good. I'm happy. I'm happy. Really, I'm happy. Just a few notes, okay? Few very minute notes, okay? Is just don't begin your consultation by hi there.
Okay.
Yeah, please, okay? You are in the exam. Hi there is not formal, isn't it?
Okay,
You
yes.
can say to your colleague, anyone with your same age, yeah,
Mm,
but a patient, no, please, okay? Not hi
mm,
there at all. Your
mm,
introduction was great. Okay, I felt very smooth consultation, very empathetic, sympathetic, and you did pick maybe in the beginning you didn't pick night. Last night was weird little bit. Last night was weird little bit. So I needed to say it I think 3 or 4 times.
mm,
So if the actor is saying a word more than once, then
mm,
this is a cue, okay, and he
mm,
wants to help you, okay.
mm,
So maybe that make you lost little bit of time, maybe 10,
mm,
20 seconds. But other than that, I'm to be honest, I'm happy. Maybe you needed just to double check the asthma control because according to
mm,
it you would that will determine which emergency contraceptive, although um, maybe this will be the SARC team decision, but we
mm,
don't know if she will be happy to continue because most of the cases will refuse to to take the things further, unfortunately. Okay, and then she will just, okay, that's fine. I will just forget what happened, and if you can help me, doctor, and give me some contraception, and then this will put all the decision on you
mm,
in such instance. So you need to know if her asthma is controlled or not. Okay, because if her
mm.
asthma is not controlled, then that will remove which emergency contraception from the equation. Which one?
Livonel, Livonel.
Yeah, Ela one,
Uniprestal.
Ela one,
Yeah,
Ela
L.
one.
Uniprestal. Yes.
Yeah,
Okay.
yeah, Ela one. Okay, so Ela one is contraindicated in uncontrolled asthma. Okay, especially if she's taking prednisolone, tablets on continuous basis. Okay, or frequent basis, then you cannot use the Ela one. Yeah, but morning after pills, as Dr. Rohan said, okay, morning after pills. Okay, and we can also use Dr. Rohan for any input because he's originally a gynae doctor, you know, before being a GP. So also, if you have any notes, I'm more than happy to see what he will say. The other thing also, as you said, if the patient, you might need to also to, you know, to talk little, for sure, not in this case scenario, because that will be a lot, but in case that, you know, the thing changes and make, you know, and the story was shorter, okay, because I'm happy with the way how you proceed and close the case. You might need to increase a little bit about what SARC will do, if the police need to be involved or not. Again, this we will discuss during the explanation. But if this patient told you, you have time and you discuss with her about her period, okay? So what is your timeline regarding, you know, regarding the unprotected intercourse and, you know, the modalities of emergency contraception? Is my question clear or need to elaborate it more?
Uh, Sorry, I mean, you're asking, I mean, me or
Well, no, I'm asking Isra. If Isra, if she don't know for sure, we will take your opinion. Isra, are you there? Hello, Dr. Isra. Oh, she disappeared. What happened? She is there or hello? Are you hearing me, doctors?
I can hear you.
You can hear me, so Dr.
Yes.
Isra. Oh, I'm not sure
Maybe
where
she's
she
gone
went.
somewhere.
No, I think maybe her. Okay, let me just try to. If not, then we can just proceed and discuss. Um, Let me double check if she is there or she left. Most probably her internet. Yeah, I cannot see her, so most probably her internet can.
Hello, can you hear
No,
me?
she's there. Yeah, yeah. Are you
Oh,
there?
sorry,
Yeah.
my mic was muted.
No, no,
Okay.
no, no, no problem.
Yes.
Yeah.
Okay.
So,
So
shall I
basically,
repeat my
yes, yes,
question?
please, please go
Ah,
ahead.
yeah. So you know we have two type of emergency contraception, isn't it? So we have
Yes,
hormonal one, okay, and we have the IUD, isn't it? Okay.
yes.
So is this, you know, the timeline of the intercourse,
Hmm.
okay, and the menstrual cycle
Hmm.
is important in which modality you would consider in treatment the patient and emergency contraception.
So basically, in this case, because desogestrel has only a missed dose of 12 hours, so she
Yeah.
definitely needs emergency contraception.
Yes,
First
exactly.
time, as the first measure, we do offer them tablets, isn't it? But for long term, if it has happened multiple times that someone has had unprotected intercourse for multiple times, then we are thinking more about putting in a coil because if they don't want to conceive or have a pregnancy, then it's more about thinking about the coil. Also, if the ovulation is more than within the 72 hours, within 72 hours of unprotected intercourse, then it's Lemonel. But if we are thinking that it's more than 120 hours or might be at any time of around ovulation, then we are thinking more about the copper coil, isn't it?
Well, yeah, I'm with you, but the issue is, you know, the gold standard on the most effective emergency contraception is the copper coil. The
Copper coil,
problem,
yes.
yeah, the problem that we are not offering it because of two reasons. It's invasive, okay, this is one, and
Hmm.
then the you know the expertise of inserting it is not always available, okay.
Hmm.
That's why we are offering the hormonal, but sometimes you are forced. So easily in the exam, they can force you to avoid, you know, something, and you know, and it will be only one choice. For example, if this is an uncontrolled bronchial asthma, okay,
Hmm.
then you cannot provide Elawan, yeah. And
Hmm.
then if this patient have the intercourse more than 3 days, then morning after pills is out of the equation.
Hmm.
The other thing that they can force both of the hormonal contraception if this patient is presented with the intercourse after ovulation, yeah,
Hmm.
because the hormonal contraception, the emergency hormonal contraception depends on what? In delaying the ovulation. So if the ovulation happen, okay, it's out. There is no use for it. Okay, so then you will be forced for using, the copper coil only. And then they might make the things more complicated. I don't think in the exam, but maybe in your real life, you might find some complicated cases like this. If this patient have an intercourse, she is in the second half of the cycle, and then she's presented with STI. Okay, then this is more difficult. Or putting the copper coil is can cause harm because that can spread the infection.
Hmm.
And then at that time, then you are forced to refer the patient without doubt to the COM clinic because you need their, specialist input.
Hmm.
Is that clear? And maybe
Yes.
later on after we discuss, we'll ask also Dr. Ruhan if you have any input in this case scenario. If the patient have STIs, so which is the best modality, and they are in the second half of the violation. But at the end, we'll keep it
So
for
in this
Dr.
case, basically in this particular case, will we just say about morning after pill, then only the Levonel?
Yeah, usually you will give her the Levonel, okay?
Hmm.
Yeah,
Okay.
yeah.
Okay, thank you.
No, 1 minute, don't go still. Don't
Yes,
escape.
okay.
Yeah. So yeah, then you ask about the spice, was good. You're asking about the spice, because really it's a long case, so I don't
Yes.
want, I don't want you to ask more than what you ask. And in the management, maybe you need to elaborate more
Hmm.
because that's important, because if something like that appear in the exam, they want to understand if you know
Hmm.
the available resources, okay? And for sure, as you said, you will refer her to the SARC, and then you need to know what is the SARC is available, what the SARC is providing, isn't it?
Hmm.
So SARC is the sexual assault, hub, okay, or referral center, and they have the medical examiner, okay, medical examiner, which is forensic doctor,
Hmm.
which he specialized in, taking the forensic evidence. Okay, so
Hmm.
saliva, Siemens, bite marks, all of this, they can, document it, okay, and then compare that with the, if she wants to upgrade the things with the police, to compare that with the perpetrator, okay, even the
Hmm.
bite mark, so they can make a mold of the bite mark, they can make, three-dimensional, models of the bite marks, and then compare it with the proposed perpetrator tooth, okay.
Hmm.
The issue is we have a timeline for that, and this is the most important things, because the problem, the DNA will vanish from her body within 7 days. So if she presented within 7 days, just emphasize on her to to present early to the SARC. This is one.
Hmm.
The other thing, which is your duty, because in these cases, you will be guidance only for the patient. I don't advise to do any examination other than blood pressure and okay,
Hmm.
and
Yeah.
excluding life threatening, because they might assault her badly. Okay, this one,
Hmm.
he might use some drug to to just make her sleep, but then some people will use force, and then you need to examine the patient, make sure that she doesn't need to go to the ED, and stop any life-threatening bleeding, or manage any cut or suturing. So this is your your basic work here. First, understand which is the best next step, okay, and making
Hmm.
the patient understand what are the available resources. Is it an A&E case? Okay, there's any life-threatening injuries? Okay,
Hmm.
heading injuries. Does she have a bleed and she don't know? Okay, so don't examine the pelvis, but at least have a look from outside. Don't examine the vagina, but have a look from outside. If there is any bleed, if there is any major tear or not. Okay, this is one. Then, if you are sufficiently happy that there is no indication to refer the patient to A&E, Then you will then discuss with her, does she need to involve the police or not? Okay, and involvement of the police in such situation, it can be a choice, can be a force. Okay, even if the patient refusing, you might need to, to overcome his wishes and just, break the confidentiality and inform the police. And that in two situations, does anyone know, or Dr. Isra, do you know when you should inform the police and, break confidentiality of the patient?
I suppose when patient is at risk of serious harm, and for example, as you mentioned, that it's something that she's been bleeding a lot, and bleeding hasn't stopped, for example, or
No, she might be bleeding and still she don't want to inform, maybe maybe he's even broken her bones and she don't want to inform, and she is happy not to inform. Then you can't break the confidentiality except if there is weapon, okay? If there is gun, knife,
oh,
or because he might do that to her and then he will do it to other people. So if there is weapon, you need to inform the police. And the other thing, if this is a minor, okay? If this is not an adult, okay, and this is an assault, okay, then you need to inform the police. If he's less than 13 years old, you need to inform the police without doubt, even if the parents are refusing, even if the patient is refusing, okay? Other than that, it's a matter of a choice, okay? If the patient
yeah.
don't want to involve the police, she's, don't want in the acute stage, maybe she need to think, okay, maybe she's worried from the perpetrator, then you give her some space, okay, and let her think. Okay, then the SARC referrer will do the spacement. Okay, so they have multiple agency inside. The SARC is, is a center that have a lot of people working it. One of them is the medical examiner or the forensic examiner, which will take, as we said, the specimen, okay, and the timeline is 7 days. And the other thing in that case, also they will examine her for drugs, okay. So they can take urine specimen. The drug can appear in the urine up till 1 month, okay. In the hair or skin, or nails, it can stay for in the body until 3 days, but
Okay.
in the urine can stay for 1 month. Okay, so you need to emphasize on her, please, 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 don't change your underwear,
Hmm.
don't take shower, don't wash
Okay.
your teeth, don't cut your hair. Okay, she need to keep everything, and even the clothes that she was there with at his house, to keep the same clothes and go with it to the medical examiner, because they will be then, to distract any evidence, okay, of assault. Okay, and that's why you don't need to examine her. Inserting the speculum in her vagina with the gel can easily remove all DNA remnant or semen. So please, please don't touch such patient. You will destroy the evidence, and then you might make the perpetrator escape from justice. Okay? Not that you are escaping from responsibility. No, you want to help the patient. So trying to do such examination will cause harm. Okay, and then they would provide her with psychosocial support. Okay, because these patients will have multiple injuries. Post-traumatic stress disorder and anxiety, stress, depression, self-harm. All of this need to be assessed. Okay, on the long run. Okay. Um, uh, um, Also, during your life, because you might meet people that have sexual assault in your in your practice, that they didn't inform. Okay, and one of the things that you might see, that the patient will avoid intimate examination, or they will refuse to have a speculum examination. So keep in mind that that might be trigger of previous assault. Okay, if the patient have issues with the speculum examination, okay, or even or avoiding even with females, okay, avoiding even with female examination to be done, that can give you a hint. Okay, because not because they don't want to be examined, or not because they don't want to be treated. It's like post-traumatic disorder. Okay, putting them in that position, trying to insert the speculum, that will trigger all the bad memories. Okay, so be cautious, be in mind that you might, and don't feel offended if one female refuse to do speculum exam or intimate examination. Okay, even by a male or by a female, because you might face something, cases like that. Female will refuse anyone to examine her. Okay. So don't be offended. Just keep it in your mind. That might be a consequence of assault. Okay. The other important things that you need to speak with the patient about is the post-exposure prophylaxis. Okay. And that's something that you need, you be in mind with it, and the patient should be, aware about it, because if they refuse to go to the SARC, they refuse to go to the police, they refuse to go to the gum clinic, then it's in your playground. No, then it will be your responsibility. Okay. What should you do? Okay. Such patient, you need to provide them with, maybe you first time to hear about that, but there is something called post-exposure prophylaxis for bacterial infection. Okay, so you need to treat these patients empirically with antibiotic, and we will say what is the regimen. Okay, the other thing, post-exposure prophylaxis of HIV. Okay, within 72 hours, and then post-exposure prophylaxis of Hep B, which in the form of the rapid, the short course vaccination. Okay, they will give him the 3 injection of the vaccine, I think within a month, which is called the rapid, or month or 3 months, I can't remember exactly, but it will be a short access, or short course immunotherapy
So all this will be
vaccine.
given by the SARC team, or we have to give?
No, this will be given by the SARC, but the problem if the
Yeah.
patient refuse to go to the SARC.
Uh,
Okay, so if they refuse, then you need to, you need to take this in consideration, that you need to give it to the patient. Okay, although it will not be available, maybe you can ask the gum clinic to help you on that. But all of that you need to try to convince the patient for. Okay, that you need bacterial prophylaxis. Then you need to inform, to give him a hint, because if you don't know, then
okay.
you will not be able to advise the patient, and you might not be able to convince her. But if you tell her, we need this antibiotic that we cannot provide, we need HIV treatment that we cannot maybe provide, and this is serious infection, and hepatitis B vaccination we can provide, but the immunoglobulin, because you might need to give her immunoglobulin as well, depend on the perpetuator baseline. Sometimes you will not be able to find the baseline of the perpetuator, so you will treat her with all of that empirically. So having this knowledge will help you to guide the patient what is the best available choices. Okay.
Okay.
And lastly, is there a safeguarding issue or not, especially if she's a child or female that was abused by a relative? Then the safeguarding team need to be convinced or informed. Okay. And then taking the decision of, because this is for you doctors, taking the decision of, breaking confidentiality cannot be depend on a solo doctor opinion. Okay. Before breaking any confidentiality, and you need to be, back, your back should be a hold with another doctor. Okay. Don't go alone and just break the confidentiality. You need to discuss the case either with the safeguarding lead or with the senior clinician in your GP practice. If both of you, agreed that you need to break confidentiality, this should be clearly written in the notes. Okay, you don't know what will happen, you don't know what is the medical legal allegation can come to you, so you need to have a backup opinion from another doctor. Okay, not only your solo opinion. Okay, if say the patient don't want to inform the safeguarding, and it's find that this is a safeguarding issue, you need to have another opinion from another doctor. If he said yes, write his name clearly after his approval in the notes, and then break the confidentiality. Okay, don't take it on your shoulder alone. Okay,
Okay.
and then we said the timeline. You need to document everything in time. Okay, so this patient came on that, said that she was, in that time in the restaurant, wake up in that time, and that guy, flat. So everything should be documented by time. Okay, which is something we don't used to do it in the primary care, but you need to write that in time, and use the third person quote. Okay, like I don't know if you went to any of the mental health rotation during your training, Dr. Asra?
Yes, doctor, can
Yeah.
you repeat the question?
Yeah, you need to use the third person quotation when you are writing the notes. So the patient
Oh,
said like this and put two brackets and write them. So like the way that we are writing and in the psychiatry rotation. So I'm not sure, did you want to psychiatry rotation?
No, I didn't.
Okay, so the people that want to psychiatry rotation, the doctors that want the psychiatry rotation, they will understand that we never say your opinion or your judgment. Okay,
Oh,
you are always
right. What the
writing the
patient
third.
has
Yeah,
said.
the patient say Miss for this said, and then write what he said. Don't put your opinion. You don't want to be, you don't want to be hooked in any medical legal problems. Okay, so always be neutral and say the patient said, I was told by. You can always, use the third person, quotation in such documentation. Okay.
Okay, thank you.
Uh, so this what I want to say, to be honest, in such cases we can have, is that clear, doctor? But in general, I like your way. Yeah, it's only I think most of it is just a little bit of more knowledge about what is the available resources. Okay, and you might also consider telling her that urine sample so that she don't, if she can hold herself and don't pee and take the first urine sample after the after the illegal assault, that will be helpful.
Oh,
Yeah, let's have a look at the PowerPoint. Okay, let's have a look at the PowerPoint. So the magnitude of the problem, you have 20% of the females before the age of, from age of 16 above in the UK that was was exposed to a sexual assault, harassment, and 4% of the men. Okay, so and 90% of the cases was assaulted by someone they know. Okay. So Dr. Asra, do you know what is the difference between rape and sexual assault?
sorry, can you repeat the question again?
Yeah, what is the difference between rape and sexual assault?
Well, rape is absolutely something, for example, if it was a stranger, she didn't know anyone and
Mhm.
that person at all and just met them randomly and, they used force. This man probably gave her some drug or something, so that's why she doesn't remember anything and then made it happen. So this is more of an assault, isn't it? When she's more familiar with that patient for last 3 to 4 months and things, but rape is something like in no way their consent is involved and it's more forced and coerced and the other person is also aware, isn't it?
Well, yeah, you will be surprised that, well, according to the law, this is not the definition of rape and assault. So rape for them is done by man. So rape is penetration with the penis. Okay, anywhere, either oral, anal, or vaginal. Okay, this is a rape. But sexual assault mean that any other form of, improper touching or
Oh,
even using, an instrument to, in the sensitive areas or even fingers. So this is, so sexual assault is larger umbrella, okay? But rape is always done by male perpetrator, okay? So female can assault males, okay? So but cannot rape them, can assault them, okay?
oh,
This is according law, okay? According law, okay? So, and this is what is called Sexual Offense Act on 2003, okay? Which is, the main act that, in such cases is the reference, okay? And any child less than 13s, okay, with any sexual assault or is considered to be a rape, okay, even if it's even if he's give the approval of that, it's any sexual behavior with a child less than 13 is considered sexual assault or rape. The question here will be if two children, okay, two childs, both of them are 13 or less than 13, and they have a sexual, encounter, what is that, what that will be, how you will act on that if it came to you, okay, in your real practice, a patient less than 13, and then there is a problem. Okay, they have, for example, a sexual act between each other. Both of them are less than 13. How you would you act on that? Anyone have opinion, or Dr. Isra, or anyone around?
Yeah, actually, Gillick competence and Fraser guidelines apply between 13 and 15. So
Yeah, then
anything less than
well,
13 is complete violation of there's it has to be like what
yeah,
you would
this
say.
is, yeah, this is if adult and one below 13, or one above 13 and low, and another one below 13. But if both of them below 13, then what we should do? How you would think about that? Because below 13 is a statutory rape. The police should be
Yeah.
informed. But then if both of them are childs, and would we inform the police for both of them child, which you
No.
can, okay, so how you will think about it?
So between
Safeguarding thing.
13 to 18, first of all, yeah, we have to think about that what they are doing. Do they have full understanding about it? Do they know that if they don't take contraception, they have a fear, they can get pregnant as well? What are their thoughts about, how are they managing finances if that happens? So there are a lot of things to ask the patient's understanding if they are aware of everything, accidents and stuff that can happen, and outcomes in terms of
Is that
pregnancy.
below 13, you mean, or from
No, no,
13 to
no. For
16?
below 13, it is
Yeah.
straight away involving the police. But for 13 to 18, it is, I think it is about more about checking their understanding, isn't it?
Okay. Yeah, checking understanding is above 13, but then below 13 is still is still, I will not involve the police. Okay. And I'm not sure Rohan, what you think.
Yeah, definitely not police if both are below 13, but definitely it calls for an urgent, like sort of a safeguarding action,
Exactly.
because they, because by law, or if you look at it, we are not they are children, so it is not expected. I mean, what is their level of understanding, as she said, like as Asma said about
Yeah. Yeah,
what are they doing
exactly.
actually?
Ex- Exactly, but the problem that there is a third party involved here, okay? And this is what the safeguarding team should highlight, okay? Because now this is where are the where are the relative, where are the guardian, where are the parents of these children? How that happened? Then the relative here are should be questioned. Okay, the parents should be questioned. So definitely you will involve the safeguarding team without doubt. Okay, involving the police will be depend on the investigation of the safeguarding team, what they say and what they find. Okay, if there is neglect from the parents, then the parents are to be, you know to be liable for for legal action. Okay, if not, then we'll see what the safeguarding team will say. Because I'm not sure that anyone, if you attend the, when there is a safeguarding regarding children, and there is like multidisciplinary team involved in the investigation. One of them is the police. Okay, so if you attend the mark or the hark meeting, usually there will be a police, there will be safeguarding team, there will be nurses, doctors might be involved, and midwife, social care. All of these will be in the meeting. Okay, and then they will decide. It's not one man person decision. It's a multidisciplinary team decision to see if there is any, any legal issues should be involved in such cases, especially against the guardians. Okay, either the guardian can be the parents, or the one who's taking the responsibility of the child. Okay, is that clear? I hope this point is clear. Yeah. Is there is any because always this
Okay,
area
because I
is a
always
matter
thought
of
that under
questioning.
13 it's straight away to the police. So we have to,
No, if
what
both
you're
of
saying
them,
is no, it is safeguarding.
no, let me recorrect this. If both of them under 13, but if it's one under 13 and another above 13, adults, okay, say above
Yes.
18, then this is a police matter, okay, because this is a
Oh,
rape. But if the age difference is very small, say both of them are below 13, or one is 13 and the other is 14, okay, so there is question mark here because above 14 considered to be, you have the mental maturity, then maybe Fraser here and Gillick competence should be tested. And then the one below 13 is a matter of, it's absolute rape. So then here is a question mark, query mark. Then the safeguarding mirror again need to have their input, and then the decision to involve the police and upgrade it to a crime, it will be depend on the outcome of the mark team, okay, which in the multidisciplinary team. Okay, but if it's above 18 and then the other one is below 13, is definitely rape. Okay, clear?
okay.
Yeah, and the other thing, if then if the patient even above 18, say from above 13, so say from 13 to 16, and then the one that he have sexual relationship is is the responsible man about him or woman, or the what is the name of the in the position of authority, okay, teacher or then this is a rape, okay, even if the patient is Gilead competent, okay. So Gilead competence will not defend the perpetrator always, okay, especially if he's in authority. If he's in authority, then this considered a rape, even if the child give approval about that, and even if the patient is Gilead competent, okay. I hope that clear. If anyone have question in this area, because it's always a matter of confusion. Nope. Okay, good. So,
Um,
and then this, yeah, to continue, doctors, no one have question to continue? Okay. Then psychosocial harm was said, and the sleeping disturbance, or especially if the patient present with sleeping difficulties, please don't dismiss it. Don't only write diazepam or Zubiclone and just finish the case and go to the other. No, try to understand why this patient have sleeping difficulties. Okay, sleeping is important. So if your body is deprived from sleep, then most probably there is something bothering your body. Okay, there is something happening behind that. So for sure, treating of the sleeping difficulty is not sleeping pills, is treating the root cause. You might give sleeping pills for short term to help the situation, okay, but not for treatment, please, because a lot of patients I'm seeing that they are hooked on sleeping pills, and they are suffering to get rid of it. Okay. Physical examination already discussed that in detail, and then the social harm. And this is what the SARC team is. So SARC team is involved, forensic examiner, emergency contraception, post prophylaxis, and psychosocial and legal advice as well. Okay, it's worth Google what is the nearest SARC office, okay, or center near you, and just to know, okay, you don't know when you will need them, so at least have a thought. And if you are still in training, ask your supervisor that you want to go to have a visit there and see what are their activities and what they are offering to the patient. It will be very good experience, to be honest. Okay, ask your supervisor to release you one day and go and see. Okay, see what they have, where are they, what the locality, what is the best way to contact them, and what their advice is. Listen from them. Okay, so use your training. Don't wait until it's finished and then try to question what is the available services. Okay, and that's what I said. We need the time, the location, the characteristic, the type of sexual assault, penetrative, non-penetrative, and the contraceptions. pelvic examination. We go through all of that. Yeah. I don't think that then the blood sampling and all of that will be done by the SARC team. And so we talk about the emergency contraception. The seroconversion for HIV usually is after 4 weeks. So even if the first blood test is negative, we might consider repeating it. Okay. The bacterial prophylaxis. Okay. So usually we give cefixime, okay, which is ceftriaxone, fourth generation ceftriaxone, azithromycin and metronidazole. Okay. And if the patient is pregnant, you might omit the metronidazole. Psychosocial support, and psychotherapy or psychosexual therapy is important in such cases because the harm impact left after the impact is psychologically is a lot. Okay, and they will need a lot of help. Okay, from the psychosexual team to return to the normal baseline that they was on. This is summary of the 5 points that you need, to know in managing such cases. Okay. You can just take a screenshot of this, put it in front of you, and then you will know how to manage such case coming. And we did a lot of explanation just to, to reinforce the knowledge, but all what you need is these 4 points or 5 points, not more than that. Okay. This is the timeline where the DNA and the sampling and then when you can break confidentiality. Yep. So these are some resources. Okay, I strongly advise go and see what is the available services here. Very good websites. Okay, the last one is regarding child abuse. Go and have a look, have a read. You never know when you will need this information. Okay, I'm happy for any question regarding this case. If not, we will finish this case and we will go for the ECG. Any question regarding this case?
Thank you, Dr. Sadam,
No problem at all.
For the presentation and for the tutorials.
Mhm.
I don't know, but maybe this might just be kind of difference in semantics in terms of just wanted to know whether sexual abuse and sexual assault, whether they are the same or are they different things entirely, just like we have rape and sexual assault?
No, sexual abuse and sexual assault is the same. Okay, it's the same. It's just the difference is the rape. Well, rape is the penetrative act with the male organ with the male organ. Okay, that's according to the law. Okay, but sexual assault or sexual abuse are the same. Maybe abuses can be less invasive. Okay, but both of them are the same impact. Both of them are the same terminology. Yeah, there is no big difference between them. Yeah.
All right, then. Thank you.
Yeah, no problem. I will stop the recording and hopefully the